I'd like to welcome everyone to today's webinar. I'm Bob Gibson, Chief Revenue Officer for Jolt, and I will be your host today. Thank you for joining. At the end of the session, we will be announcing our contribution to the hospitality industry with a free subscription and immediate access to a pre-configured coronavirus task list utilizing Jolt software to digitally track actions you can take to fight the coronavirus and put your customers at ease as we look to get back to the new normal of the post-coronavirus world. Jolt is a cloud-based restaurant management solution designed to automate and simplify task management and digital food safety. Trusted by restaurants and companies in the hospitality industry, this software is also utilized by assisted living facilities, groceries, small clinics, auto repair shops, car washes, and many other types of businesses. An all-in-one platform for managing employees and business operations, it is equipped with robust features for task automation, employee scheduling, attendance tracking, team communication, and employee training. Moreover, it features compliance management options. Even when you are off-site, Jolt enables you to stay on top of your business by improving staff accountability, efficiency, and productivity, while at the same time decreasing the cost of labor. It also prides itself in providing comprehensive tools that minimize the amount of administrative work for owners and managers, helping them free up time to focus more on improving business. And we are very proud to be hosting this webinar today, and it is my honor to introduce Dr. Donald Schaffner. He is Extension Specialist in Food Science and Distinguished Professor at Rutgers University. His research interests include quantitative microbial risk assessment, predictive food microbiology, hand washing, and cross-contamination. He has authored more than 150 peer-reviewed publications in numerous books, chapters, and abstracts. He has educated thousands of food industry professionals through numerous short courses and workshops in the United States and dozens of countries around the world. Dr. Schaffner was awarded the International Association for Food Protection Elmer Moth Educator Award for outstanding service to the public in the area of food safety and food protection education. He has served on a variety of expert committees, including service to U.S. National Academy of Sciences, the World Health Organization, as well as food and agricultural organizations of the United Nations, the Institute of Food Technologists, and U.S. National Advisory Committee on Microbial Criteria for Foods. Dr. Schaffner was elected a Fellow of IFT in 2010, of the American Academy of Microbiology in 2014, and of the International Association for Food Protection in 2017. He has served as an editor for the ASM Journal Applied and Environmental Microbiology since 2005. He is also the co-host of a podcast on microbial food safety, foodsafetytalk.com. He holds a bachelor's in food science from Cornell University and a master's and PhD in food science and technology from the University of Georgia. It is my honor to now turn the presentation over to Dr. Schaffner.
Thanks, Bob. I appreciate the introduction. So like all of you, I'm working from home today. Like some of you, you may have pets around you, and my dog loves to stay with me while I stand here at my standing desk and work. But now is peak dog walking time in my neighborhood. So if you hear jingling of dog tags or barking, you'll know that that's coming from me. So apologies in advance. So we're talking today about risk-based controls for food safety in the time of coronavirus. And so let me give you an overview of what I'm going to say today. Although the primary focus today is coronavirus, I want to open with an example talking about food safety and food safety risks. And that example is to show you that sometimes when we think about risk, it really, the concept of risk may sometimes be non-intuitive, okay? And I think you'll get a better idea after I give you my example. And then I'm going to move to talking about hand washing, which is something that we know a little bit about. We've been doing research on hand washing and cross-contamination for almost 20 years now. And obviously, in light of the current pandemic, I've been talking a lot about the importance of hand washing and use of hand sanitizers and such. And the example I'm going to share is actually some research that I've had the opportunity to be a part of that has not yet gone for peer review. So you guys are getting a little bit of a glimpse into the details. I can't talk too much about it because, like I said, it's not gone out for peer review. But it does. The example does very nicely illustrate this idea of risk and the fact that there's no such thing as zero risk, but if we do the right thing, we can manage and reduce that risk. And then lastly, I want to talk a little bit about COVID-19. Now, again, I don't know about you guys, but I have been living, hopefully not breathing and eating coronavirus for the past couple of weeks. And I've had to learn a lot, and I've got some thoughts about how we can continue to manage food safety while at the same time making sure that we manage coronavirus risks. And it really dovetails very nicely with the stuff that Jolt are talking about, because their platform is really all about flexibility. And so I want to give you some examples of just what I mean by that when I get to that part of the presentation. So let's first talk about food safety risk. Now, when I do this in front of a live audience, I ask people to raise their hands, okay? Now, the good news is I probably know what you're going to do. You don't need to actually raise your hand, but I do want you to come up to answer this question to yourself before I move on to the next slide. So the question is, would you rather eat in a restaurant that keeps half of its cold food at the recommended food code temperature, or would you rather eat in a restaurant that keeps 95% of its cold food at the recommended food code temperature? Okay, so it's a simple question. Don't overthink it. Just mentally, get your answer ready. Do you want 50% risk, or do you want 95% risk? Okay, so just think about that for a minute. Get your answer in your mind. Okay, now. What I didn't tell you was I actually didn't give you, I didn't really ask you the right question, because the question is not, is the food in or out of compliance? I mean, from a regulatory point of view, yes, the inspector is going to ding you if your food is out of compliance. But if we move to risk-based thinking, it's not just about whether the food is out of temperature control or not, it's how far is the food out of temperature control. And I came across this example because some of the work that we do at Rutgers is around assuring food safety in the dining halls. Now, right now, the university is closed, and so we're not serving any food in the dining halls, although we do have a limited population of folks on campus. It's mostly being served through like grab and go pickup of sandwiches and stuff like that. But when the dining halls were open, and when hopefully they'll be open again, I want you to imagine a scenario where we have two dining halls that you can choose to eat at. Dining hall number one is the example from the previous slide. This dining hall has 50% of its food out of temperature control. But now what you can see from this particular graph is that the first 10 foods are all at 40 degrees, but the next 10 foods depicted by these blue bars, those 10 foods are at 42 degrees. And so those foods are out of temperature control. Now, dining hall number two has a 95% success rate. And you can see that because it has 19 out of its 20 foods being stored at a temperature of 40 degrees or less. But dining hall number two also has this final food, this 20th food product, and that food, which should be stored at 40, is actually being stored at 60. And so of course, the solution is you want to eat at dining hall number two, except you just don't want to pick that food that's really far out of temperature control. So how would you go about assessing the risk? And to do that, I've created a little mathematical algorithm that basically sums up the risk over the number of foods that are being sampled. And so this just shows you how the algorithm works. We basically, every time we see a food that's out of temperature control, we look at how far it's out of temperature control, and then we add that number to our risk number. Now, of course, there's some tremendous assumptions built into this. It assumes that the food is out of temperature control for some period of time. Now, we know in the dining halls, we control that risk because we only put food out for service during the meal time. And then at the end of the meal shift, any leftover food is discarded. And so one way that we manage the risk. We're also assuming, of course, that all of the foods in this example are the same. They're not different in terms of pH and water activity. And of course, we're also assuming that they might have some pathogens because the pathogens are what's growing at the higher temperatures, and that's what's driving the risk. Now, of course, that's not really true. Most of the foods we serve don't have pathogens. They have all sorts of different variations, and we're only keeping them out for the food code recommended 4 hours or less. But again, for purposes of assessing risk, we do want to know which is the worst practice. And so what you can see is that we have this number, which I'm calling risk, which is dependent on the temperature. And so we calculate that risk by looking at the temperature of each of the foods. And then when we get to the 11th food, in dining hall number 2, that food is still okay, but in dining hall number 1, it's a little bit out of control, so the risk number for dining hall 1 goes up. And that number keeps going up and up and up until we get finally to the 20th food product. And at that point, the dining hall number, its risk increases slightly. And then finally, we see for dining hall number 2, the risk jumps up through top, winning the race in the end because of that one food that was being held at 60 degrees. And so I hope that little example teaches you a little bit about risk and about how I think about risk when it comes to microbiological food safety. Okay. So just a little bit more about that. Let's just look at the sample data that would come out of a report that we have here at the university. You can see I'm showing you foods like black olives, tuna fish, red beans, and hummus. Those foods actually all are at a really good temperature control, but you can also see at the bottom there that this facility had 58 out of a possible 70 foods at the appropriate temperature. So you can see that the failure rate, right? That failure rate is, or that out of compliance rate is 82%. But the good news is that because many of those foods were only just slightly out of temperature control, the overall risk score, according to my algorithm, is 96%. So what this lets me do is when I generate these reports, it lets me very easily see not just what fraction is in or out of control, but what's the overall risk score. That lets me look through pages and pages of data and then just sort of jump to the bottom line. And then if there are problems, I can see which foods they are. And then that lets me take that information and share it with our university sanitarian so that he's not alarming or alerting over a situation where there's really sort of marginal departure from what we'd like the score to be. So basically, again, our algorithm rates higher temperatures to a higher degree. Okay, so let's change gears now, and let's move to a discussion of hand washing. And this, again, as I mentioned, this is research that has not yet been submitted for peer review. And I'm not going to go into a great deal of detail, but it really tells the story about risk, I think, in a really interesting and exciting way. And actually, I'm looking forward to getting this published. So basically, in this research, we study people in a kitchen environment. We used a harmless marker microorganism to track cross-contamination in the kitchen. We also observed what people did in this kitchen, and we looked at their behaviors, including their hand wash behaviors, and we rated their hand wash on a 6-point scale. They got a 0 if it was a particular step in the operation where they should have washed their hands, but they didn't. And then they get a 6 if they did a perfect hand wash. And of course, there were many components of the hand wash. Did they use water? Did they use soap? Did they wash for the appropriate length of time? Did they appropriately dry their hands, etc.? And so we look at all of those. And we just try to, for every either every hand wash or every time that there was supposed to be a hand wash, we rated that on a scale of 0 to 6. So now what we did was we looked at the likelihood of cross-contamination. And so what you can see here is this is the probability that there would be a contaminated surface somewhere in that kitchen. And so what you can see is that here, and we have 4 panels. I realize it's a little bit hard to see, but I'll walk you through it, okay? So we have 4 panels. This is an average of a 1-second hand wash, an average of a 3-second hand wash, an average of a 5-second hand wash and then a 9-second hand wash. On the y-axis is the average score for hand washing. So 0 is they just did a terrible job. 6, they did a perfect job on average, and then the different scores in between. And then across the bottom here, this is the percent of the times that they attempted to do a hand wash. So obviously, if you're perfect, what you'd like is and of course, well, we also know that people should wash their hands for 20 seconds. We also know that that doesn't happen, right? And so we mostly saw people when they were in this scenario washing their hands. The best anybody ever did was an average lather time of about 9 seconds. Okay, so let's look at the 9-second data here. So if you're up here in the upper right-hand corner of the lower right-hand panel, okay, and I think you guys can see my mouse, basically if you're at an average score of 6 with 100% compliance, the probability that you're going to see a cross-contaminated surface in that kitchen with that person working is very, very low. It's less than 5%. And so you can see that that's obviously a perfect scenario. Now, what happens when instead of having somebody with a 9-second hand wash, they have 1-second hand wash, okay? But they also have they score 100% in terms of compliance, and they have a really high average score as well. Now, of course, we know they're not going to have a high average score if they only wash for 1 second, but that's just a feature of the way the model works. But what I want to call your attention to is this number up here in the upper right-hand corner of the upper left panel, which basically says that the probability of a cross-contaminated surface is almost 60% or 0.6, right? And so what's the take-home message from all of this? Basically, the more you try to wash your hands and the better the job you do of washing your hands, the less likely you are to cause cross-contamination, right? And so that's the risk-based approach, right? It says, look, these are the things we want people to do. We know that if they do those things more, they're going to have an overall lower risk. And we can actually quantify that with the data shown in the figure. I'm going to move to a different example from the same research, and this is the level of cross-contamination. So remember this is the probability that there will be a cross-contaminated surface. So was the marker organism found somewhere in the kitchen where it shouldn't have been found? Now we're looking at the level of cross-contamination. And these levels, these lines now represent logarithm concentrations, okay? So if you see a value of 3, that means 10 to the 3 or 1,000 organisms. If you see a 4, that means 10 to the 4th or 10,000 organisms, right? And so now we're looking at the relationship, the same two basic factors. What's the average score for hand washing? What's the percent of the time when they tried to wash their hands when they were required to, or when they should have according to what we say in the food code or best practices? And then again, those 4 different hand washing times, an average of 1 second, 3 seconds, 5 seconds, or 9 seconds. And again, what you can see is the same thing holds true. If you do a 9-second hand wash, you wash your hands almost every time you're supposed to, and you end up washing your hands for with a score of 6, which means you have a really good technique. You're doing it, you're using water, you're using soap, you're using the appropriate amount of time, you're drying your hands appropriately, et cetera, et cetera. What you can see is that when you find microbes on a surface, that level is very low, on the order of a half a log. So basically less than 10 organisms per surface, right? And so the good news here is, again, you can both reduce the number of contaminated surfaces as well as the level of contamination on those surfaces as you do a better job, both in terms of trying to wash your hands and your technique for hand washing. Okay, so that's, again, a data dump of a whole bunch of data, but I hope, and I know I moved through it pretty quickly, but I hope the point from this is clear. And again, the take-home message is risk reduction is not about something being perfect. It's just about doing the best we can. We know that we're never going to be perfect. We're never going to reduce all risk, but let's focus on the important areas, and then let's try to reduce that risk wherever we can. Okay, so now let's move to what I'm calling flexibility in the times of COVID-19. And we, again, and you guys have been in the same situation as me. I've had to learn a whole lot about COVID-19 in a short amount of time. In fact, I'll even share a personal anecdote from my own experiences. So, as was mentioned at the top of the call, I do some podcasts. I am also a guest on some other podcasts. And one of the things about podcasts is it kind of preserves for posterity in a very easy way what you said and when you said it. And I'm sorry to say that at the time of recording a podcast as a guest on another podcast, I made the statement right before things started to get really weird with coronavirus. I made the statement that heck yes, I would go on a cruise ship. And it turns out that was probably a bad thing to say. As I learned, and I've since obviously reassessed my opinion. And so I mean, we need to be flexible. We need to be aware that new information is coming out all of the time. So what's the current state when it comes to COVID-19 transmission and coronavirus transmission and the food supply? So right now, we believe that the virus is not transmitted via food, and we have seen no evidence to suggest that that statement is changing, right? So that the CDC is saying that, FDA is saying that, USDA is saying that. We also believe that social distancing is the best measure for preventing disease. And so, of course, the key here is to stay away from other people as best you can. That's easy if you're a university professor like me and you make your living by writing and talking, because I can write and talk at my home just as easily as I can anywhere else. Not so easy if you're running a restaurant. It's really hard to run a restaurant from home. You have to actually be in the restaurant. You have to work with other people, right? And so that's a real challenge. And we also know, again, in these times of pandemic, we also know how vitally important it is that we keep our food supply up and running, right? We keep grocery stores open, we keep restaurants open, maybe only for takeout, but we keep operating because people need to eat, right? And pandemic is tough, and these are challenging times, but man, imagine how much more challenging they would be if we didn't have an adequate food supply, right? So again, hand washing and hand sanitizing are still best practices in terms of controlling disease transmission. And then, of course, how you implement your controls for COVID-19 are going to depend on the restaurant in terms of what your policy is for your restaurant chain or your restaurant design, or perhaps what is being mandated by local public health. So let's talk a little bit about what we think might be best practices for managing COVID-19 in the restaurant, realizing that, of course, these recommendations may change with time. So some possible practices. One practice that has been suggested is to simply take the temperature of workers when they arrive. Now, there's actually a complication with this, at least one complication with this. First of all, according to HIPAA regulations, the measurement, even something as simple as measuring the temperature of an individual, that is a medical procedure, and it needs to be done by a medical professional, and it needs to be done in the context of respect for privacy and HIPAA regulations and all of that. So while it might be innovative to measure the temperature of your workers on arrival at the restaurant, you should definitely talk to your your restaurant lawyers and legal scholars, especially people who are expert in legal and medical interface. One idea that I've heard is to run your restaurant with separate shifts. So you might have a morning shift and an afternoon shift. And the idea here is when the morning shift leaves, they clean the restaurant, they clean and sanitize themselves, they leave the restaurant. And then those people are entirely out of the restaurant when your second shift comes in. So the second shift waits in their cars until they hear the all clear sign, the all clear sounds. The second shift comes in and they do the same thing. They clean and sanitize, and then they begin to operate. Why would you want to do that? That sounds like a lot of trouble and a great deal of work. Well, again, remember, we're not talking about prevention of risk of transmission of the virus via food. Really, at this point, we're trying to keep those restaurant shifts up and running. And if you have a shift, if you have multiple shifts that run throughout the day and you have overlapping work patterns, one worker coming in and interacting with different workers over time is going to potentially spread COVID-19 to those other workers. There's a possibility you could take down your entire workforce. And so by running separate shifts with essentially clean and sanitized firewalls in between, you preserve the ability to run. So your morning shift may go down with coronavirus, but guess what? Your afternoon shift is still there, and they can keep running because they have not been exposed to COVID-19. In terms of cleaning and disinfection, one possible change would be to increase your frequency of doing those things. I haven't heard of too many people doing that. That's currently not what I'm hearing recommended, but that is a possible situation that you may want to consider. Certainly, standard food contact surfaces plus other surfaces that are less commonly cleaned should be sanitized. And if you have high touch surfaces, those should be disinfected either every night or they should be disinfected between shifts. Now, another piece of advice, let's move on to the next slide, which is my last slide, at which point I'm happy to start taking questions. Let me move on to the last slide. Remember that effective food safety is based on risk and understanding of risk and the best available science, right? And so you can't do everything, so you should do the most important things first. And by most important, I mean those activities that have the greatest effect on risk and have the greatest ability to reduce risk. That same thinking also applies to COVID-19, but realize that the best available science and our current scientific understanding of COVID-19 is rapidly evolving. And then I'll leave you with one final point, and that is we've had a recommendation that people should not be wearing masks because we need to keep the masks, the high quality masks for the medical professionals. That certainly hasn't changed, but I think we're starting to see some change of opinion on whether normal individuals should be wearing perhaps homemade masks in an effort to reduce the virus. Now, of course, if you're sick, if you have symptoms that are similar to COVID-19 or even other symptoms, you should self-isolate and you shouldn't be out in public. But we also are realizing there may be individuals, we have evidence of people that have the virus. They've tested positive for the virus, but they're essentially asymptomatic, right? So these are individuals that have the infection, but they are experiencing mild symptoms or no symptoms whatsoever. And so the key question to be asking ourselves is, what's the risk posed by those asymptomatic individuals? And the answer may be there is some risk there, okay? And so the way that you would manage that is wearing a mask. So of course, members of the public may want to wear a mask. Many people wear masks because they think it protects them. Doesn't really. But in the case of a restaurant situation, maybe we'll see, and again, I'm not making this recommendation, I'm only alerting you to the possibility that the science is changing, and you may see this recommendation coming, that in fact it is a best practice for workers in grocery stores and restaurants to wear masks. Again, not so much to prevent the spread to the food, but if you have an asymptomatic worker, that will reduce the possibility of that worker spreading the disease to other workers who are yet to be infected. So with that, again, I'll remind you, if you like the sound of my voice, please do check out my podcast. The URLs are shown there. And with that, that concludes my remarks, and I would be happy to take any questions from anybody in the audience.
Thanks, Don. Really appreciate that. We have had some questions come in while we were going through the presentation. But before I jump into questions, just real quickly, as I indicated at the beginning, we are offering a free sanitation package. It's available at jolt.com/sanitation. Just click sign up and it'll be available for you. Okay, with that, the first question, Don, that's come in is, you mentioned there's a great deal of misinformation and things change all the time. Where's the best place to go to get updated information on what restaurants need to be doing?
That's a great question. So certainly the CDC has good information. That information, however, is not specific to restaurants. So that's something to think about. But there is good information there. I know there is information on both FDA's website as well as from other organizations like the National Restaurant Association, as well as the Food Marketing Institute, which provides information for grocery stores. Another place that I will recommend, and let me see if there's a way. Yeah, I'm going to send this to all panelists and attendees. I'm going to send you that URL. That is a URL from my colleagues at North Carolina State University. My podcast partner and good friend, Ben Chapman, has been doing absolutely yeoman's work putting together resources. These resources are being reused and rebranded by universities around the country. It's your one-stop shop for cutting-edge information about the food supply and managing COVID-19. There's information there for restaurants, for just individuals. All sorts of folks can get valuable information there. So I would certainly, and a lot of it is boiled down to simple one-page documents. And again, we're updating it all the time. So on a regular basis. Every week as the situation unfolds, we're adding more and more resources. And a lot of those resources are being developed based on questions that we're getting from people. And so you can be assured that if somebody has a question, or if enough people have a question, we've got an answer for you there.
Great, thank you. Another question, if we run out of antibacterial soap, is it okay to use regular soap as a substitute?
Yeah, that's a really interesting question. So we've done a fair bit of research on antibacterial as well as bland soap. Well, I guess the good news and the bad news, depending on your point of view, if you're a bacterial cell and you're on somebody's hands, you're worse off if they're using antibacterial soap. But as far as we know, viruses are not really affected by those antibacterial agents, and so you're not really getting extra bang for your buck if you're using antibacterial soaps and you want to control COVID-19. If you are concerned, obviously, if you run out of antibacterial soap, you should switch to bland soap. But the other option, and again, this is based on my perspective as a risk assessor, setting aside regulatory concerns. Okay, I know that you are in violation of the food code if you use hand sanitizer without first washing your hands. But I can also tell you that we've done research in my laboratory, and we've studied exactly that condition, and what we've found is that hand sanitizer can work on clean hands or even slightly soiled hands just as well as a hand wash. And so I encourage you to consider that, realizing, of course, that you don't want to break the law, you want to follow the food code, but in a pinch, if you didn't have a good way to wash your hands, use hand sanitizer, or if you're in a hurry, better hand sanitizer than nothing at all. And of course, if you have the time and your hands are actually dirty, well, of course, wash your hands. But that's another option to consider from a risk perspective.
Great, thank you. Good info. So next question is, what can and should be disinfected in my restaurant, and how frequently should it be sanitized?
Yeah, well, I kind of covered that on the slide. So what I would say is that any hard surface, especially high touch surfaces, are going to be at risk of potentially spreading the virus. Now, of course, we don't have much dine-in going on anymore. So in that brief window of time when people were still eating in restaurants, the advice was to be sure to disinfect menus and things like that, because those are high touch surfaces that are shared between different customers. But right now, use use common sense, right? High touch surfaces, anything that needs to be clean and sanitized for food safety obviously needs to continue, right? And that's another point too. Food safety has gone out the window because of COVID-19.
Right.
It's more important than ever that we keep the food supply safe from foodborne pathogens, because this is the worst possible time to go to the hospital, right? So you want to stay healthy, you want to keep your customers healthy. So we need to redouble our efforts to make sure that we practice good food safety. But so again, any food contact surfaces as you normally would, and then high touch surfaces, especially high touch surfaces. Like think about your take. If you're running a takeout operation, do people come in and out through doors? Do they have to touch the doors? Well, that's going to be a good high touch surface that you're going to want to clean and disinfect as often as you're able, because that's going to protect your customers from sharing disease or virus between themselves.
Yeah, that's a great point. I think in these times, sometimes we forget the basics are still just as important, and the food safety component is, as important as the coronavirus mitigation at this point. Another question, and this one is an interesting one. Why can't the virus spread through food?
That's a really, really good question. If we replay the tape from the top of the webinar, I'm pretty sure I didn't say that. But let's answer the question, right? So,
right.
As far as we know, the virus is not transmitted through food, right? Which means we don't have any evidence. Now, of course, absence of evidence is not evidence of absence. People aren't exactly lining up to do a study where you eat a piece of food that we've put SARS-CoV-2 on to see whether you get sick or not. What we do know is that the virus, all viruses, so viruses are not alive, okay? But so for viruses to reproduce and make more virus, they have to get into a cell. A human cell in the case of human viruses, okay? For that virus to get into a human cell, that human cell has to have a receptor. Now, in the case of coronavirus, you've all seen pictures of the coronavirus, right? And the reason why it's called coronavirus is it has a corona, right? It has these spike proteins that come out all around the virus, and those spike proteins form what looks like a corona around the sun, right? And it's actually those spike proteins that have a certain molecular configuration, and that molecular configuration will associate with and loosely bind to the surface of a cell. And the specific type of receptors that those spike proteins bind to is something called an ACE2 receptor, ACE2. And I'm not a virologist. I can't tell you what ACE2 stands for, but we could Google it. It's a big, long, sciencey sounding name. And so basically the idea is for the virus to infect a human cell, it has to first get to that human cell, and then it has to find that ACE2 receptor and then bind to the cell. And then the other things that happen, there have to be other interactions that occur such that the cell basically is fooled into taking the virus inside the cell. And then once the virus gets inside the cell, the virus falls apart, and the RNA, the ribonucleic acid from inside the virus, then basically takes over the biochemical machinery inside the human cell and reprograms that cell so that instead of doing the things it was supposed to be doing, it starts making more virus particles. And then eventually those virus particles get out of that cell and they spread to other cells, and that's how it spreads within the body. And then of course, if you're infected, you've got the virus in your lungs, in your nasal cavity, you sneeze or you cough, and that basically sends airborne particles out into the world, which other people will breathe in. Now, the good news is that those virus particles settle out fairly quickly, and so the risk is minimal unless somebody basically sneezes or coughs right into your face. Now, to come back to the answer to the question, why can't it spread through food? It doesn't, as far as we know, and part of the reason is we don't think that the virus has the ability to basically interact with those ACE2 proteins on the surface of the cell and then become enveloped in the cell. Again, remember, this is still a work in progress. We're looking for evidence, and the other thing to remember as well is this outbreak has all of the fingerprints, all of the hallmark of a virus that is spread by person to person through respiratory droplets. So outbreaks have different patterns, and this pattern of this outbreak follows that. It doesn't follow the pattern of, let's say, a foodborne outbreak. And again, epidemiologists who study this stuff, they know what a foodborne outbreak looks like in terms of how the cases present. They know how a person-to-person respiratory outbreak happens and how that looks. And for all practical purposes, this outbreak continues to look like it's spread via person-to-person contact. Now, again, it doesn't mean it's not going to happen, but that's what we believe right now. And again, but again, this is a rapidly changing situation. We may see some evidence of foodborne cases, but to the essential answer to the question, we don't see that now. And really, again, the real risk to the food supply from the virus is taking out workers such that we can no longer keep the food supply running in the way that it needs to run. So is COVID-19 a threat to the food supply? Absolutely, but it's a threat to the food supply because of the effect it's going to have on our food workers.
Got it. Yeah, that's absolutely. Another question that came in is that I appreciate the benefits of hand washing, but using hand sanitizer or wearing gloves is a lot quicker and easier. Do those options present a greater risk?
Yeah, so excellent point. So as I said before, hand sanitizer is believed to be quite effective against this virus. There are viruses like that we're probably familiar with in the food industry, like norovirus. Norovirus is what's called a non-enveloped virus. Coronavirus is an enveloped virus. Non-enveloped viruses like norovirus are much more resistant to hand sanitizer. Envelope viruses like the coronavirus are very susceptible to hand sanitizer. So hand sanitizer, based on all the published data that I've seen, hand sanitizer is highly effective against coronavirus. It's at least as effective as washing your hands with soap and water. So those are good options. And then, of course, gloves. Gloves are also a good option for preventing cross-contamination. The point with gloves, and this is also true with hand sanitizers and hand washing, is those gloves are only as clean as they are, right? And so if you put on, if your hands have some virus on them, you put on the gloves appropriately, you're fine. But then if you stick your finger up your nose and you've got virus up your nose, well, now you've got virus on your gloves. So the gloves are not magic. The gloves don't kill viruses, right? But they are an extra barrier that we can use to prevent cross-contamination.
Gotcha. I know we're past the 45 minutes, but a couple more questions if you don't mind hanging on for a little bit.
Sure.
So one that just came in was, how often do you recommend cleaning services in a restaurant?
Well, again, at this point, the recommendations that I'm seeing are to continue with your normal frequency of cleaning, right? And so there's not a reason to change that unless you have a worker. If you have a worker that has become sick with coronavirus or with COVID-19 rather, CDC has some very good resources on what to do on disinfecting the workplace generally, not focused specifically on food. And so you should follow those recommendations. But right now, the recommendations I'm seeing are don't increase cleaning frequency just because it doesn't seem to be warranted. And then I see there's a question that's come in via the chat. Let me answer that as well. And it says, with your explanation about COVID not being able to spread via food, how come it can on hard surfaces? And this is an excellent question. So we know that there's been a lot of research around survival on hard surfaces. We're talking about hard surfaces. We're talking about the reason for disinfecting hard surfaces. And I think that's essentially in an abundance of caution. So imagine a scenario. A person sneezes onto a hard surface. Those virus particles remain there. Let's say the sneeze dries. I come by later. I touch that with my hand, with my finger, and then again, apologies, I stick my finger up my nose. Well, I probably didn't get too much transfer from the hard surface to my finger, but I might have, depending on the concentration, I might have got some virus particles on there. Then I take my finger, I stick it in my nose. Now my nose is nice and wet. It's got mucous membranes in there. A lot of the virus particles that are on my finger are going to transfer to the inside of my nose, and from there they can infect and invade. So that's a low probability event. Again, we believe that the virus really is spread by respiratory droplets, not by surfaces. But we have data that shows that it can survive on surfaces, and in fact, it has a half-life under the worst case conditions of about every 8 hours. So what that means is if there's virus on a surface, about every 8 hours, the number of virus particles drops by 50%. And so that's good, because that means the risk posed by that surface also drops by 50%. So again, no evidence that it's being extensively spread on hard surfaces, but it's still a good idea to clean and sanitize those surfaces. But yeah, so thanks for the question, and realize that we are still continuing to learn. But for now, we know, as my good friend, dearly departed Dean Cliver used to say, the risks of not eating still outweigh the risks of eating. And so we should probably, in the meantime, continue eating. And please don't. There's some viral videos out there showing a medical doctor washing his produce in soap. Please don't do that. You don't have to sanitize your packages when you get them home from the grocery store. Just practice good hand washing and do your best to avoid people that are sick.
Great, thank you. There's two other questions, but I'll go to the first one because I'm going to save the last one because I think I might actually be able to answer it. But you made an interesting point about the gap between perceived and actual risk. In your opinion, is the food service industry focused on mitigating the right risks?
I think so, for the most part. Yes, they're doing a very good job. Again, remember, I really believe that the risk in the food industry is that we keep the industry working, right? So the real risk is how to keep everything up and running so we can continue to feed people as we move through this pandemic. And so that's the real challenge. And yeah, I mean, the other thing I'll say too is, as I said before, and I think it bears repeating, we need to be really sure that we don't give people food poisoning during this time as well, because if that sends them to the hospital, they're going to be taking up space in the hospital that could be used for somebody with COVID-19, right. But also they have a risk of contracting COVID-19 themselves by going to the hospital for food poisoning. And so, we all need to be vigilant, and we all need to be careful, and we all need to keep doing our very best to maintain the safety of the food supply.
Yeah, that is a great point, especially in this time with hospitals already being overwhelmed. Certainly our industry can make sure that we don't add to that by not taking digital food safety seriously.
Absolutely.
Yep. The last question, and I'm going to take a stab at it, and then I'll open it up to you. Are there efficient, reliable, and cost-effective ways I can measure the quality of my employees' hand washing? Just to point you back to the screen, this is basically what we're talking about with this free sanitization. It'll be an ability for you to digitally monitor and track hand washing. So it's a great tool that's available to the market right now for free to start tracking that, to make sure that on a timely basis, whatever it is that you want to set up, that you're maintaining and tracking that through your employees. Outside of that, Don, any other thoughts around ways to monitor?
No, I mean it's definitely a challenge, and I appreciate that Jolt has a solution. And I just also want to say thank you for the opportunity to come here today and to talk with all these people. And hand washing is tough, right? There's no easy solutions, but if you know what your employees are doing and you can monitor what they're doing, you can figure out how to help them do a better job. So thanks for sponsoring the webinar. Thanks for inviting me, and and thanks to everybody who was on the call. I really appreciate it.
Great. Thanks, Don. Really appreciate your time today. And again, for folks that are interested, Don does host a podcast, foodsafetytalk.com. We were able to listen to quite a few of them, and they're very informative, and highly recommend you jump on that podcast. And with that, I want to thank everyone who joined today. Thank you, Don, and the rest of the team that put this together, and look forward to catching up with everyone at a later day. Thanks, folks.